I'd also like to acknowledge the Larrakia people, the traditional owners of where we are meeting today, and like to thank the Australian Water Association and Water Research Australia for the opportunity to speak with you about melioidosis. If I can get the talk up, which I have no idea where it is. This one here? Sorry.
Yep, just this one.
All right, it'll go automatically, sorry. Fantastic. Great, okay, thanks so much. So what I'm talking about is, I was asked to talk about pathogens in water, and I'm actually going to be talking almost exclusively on Burkholderia pseudomallei, which is the organism that causes melioidosis. So melioidosis is infection with this environmental bacterium, which is predominantly in water and soil in tropical regions of the world. It's a disease which is really important for those of my colleagues here from the Northern Territory. They're all well aware of it, and those of you who come from Southern Australia will probably not know much about melioidosis, but it impacts on us in a big way in the Northern Territory. It's also an issue in the Kimberley and in far north Queensland. It's a big issue for our veterinary colleagues as well, and it's one of the reasons why we can't have sheep in the tropical north is because they are magnets for melioidosis. There's only ever been one alpaca brought to Darwin, and it was dead within a month of melioidosis. Why people would bring only one alpaca for a breeding program to Darwin, I don't know. Normally that would be our Queensland colleagues who would sort of do that sort of thing. And goats as well are very susceptible. And there's this enormously strong association with rainfall and environmental damage. I will comment briefly on other potentially fatal water pathogens, and this is, of course, about Burkholderia fowleri, which has caused deaths in potable water in Queensland, in remote areas there. And I haven't been involved in this story, but it got a lot of media. In the Northern Territory, we do have Burkholderia fowleri in our water, in some of our water bodies. However, I'm only aware of one case that has been associated with the Territory over the 28 years I've been here, and that was someone who ended up dying in a southern hospital. We do find Burkholderia fowleri, our environmental services find Burkholderia fowleri in the water bodies at times, but we don't actually know which are pathogenic and which are not pathogenic. I don't know a lot about it, but there's a lot more to be learned about Burkholderia. But until this story came up in Queensland, I'd been saying in my talks for probably the last decade or more that the only incidences of death from potable water in Australia that we're aware of were in fact in Northern Australia, in remote communities where on two occasions there were deaths from melioidosis directly attributed to the community water supplies. And I'll comment on that briefly, but now we know about this story about Burkholderia, so there are other issues out there. We'll be hearing from my colleague Miriam Kaisley later on about some of the opportunistic pathogens in the water bodies in the Northern Territory, all of which are dealt with by the adequate chlorination. But we've never had a death from, say, Shewanella or Ralstonia, some of these other environmental bacteria which in people who are immunosuppressed in hospital can cause fatal illnesses, but are usually acquired in other ways. We have a heap of Cryptosporidium in the indigenous population, seasonally related to swimming pools and environmental aspects of households, but not coming from the water supply. We have Legionella as well, but our Legionella up here is Legionella longbeachii, which is in soil and potting mix, rather than seeing a lot of Legionella pneumophila. So that's all I'm going to say about all these other pathogens, and now I'm going to just comment on, talk about melioidosis. So we began 28 years ago, as of October the 1st it is actually, our prospective melioidosis study. And this is in the top end here in the Northern Territory. And over that period of 28 years, we've had 152 culture-confirmed cases and 126 deaths. So that's right here in the Territory, 126 deaths from melioidosis, which is a 12% mortality. The mortality when we first started this study was 30% from people infected with, confirmed with melioidosis. The mortality in our near neighbour colleagues in Southeast Asia, where they don't have access to good diagnostic facilities and good intensive care programs, is still 40% from melioidosis. It's a major issue for us. However, it affects mainly people with risk factors such as diabetes, and we've only had 50 children over that time, but we've had 3 deaths from melioidosis in children. So this is just showing our cases over the time up until the 2011-12 season, 85% of our cases occur during the wet season, which is starting, you know, over the next month and then up until May or so. And you can see that something happened in 2009-10 such that our baseline average number of cases has doubled from a median of 27 over the first 20 years of our study to now over 50 cases. And indeed, in the last 12 months, we've had 52 cases, without it being a particularly wet sort of 12 months for the Northern Territory. So 52 cases and 5 deaths in the last 12 months in the top end of the Northern Territory. So some of the work we're doing is around genomics or molecular genomics, and it's really taught us an enormous amount about this bacterium and its role as an opportunistic pathogen causing disease in humans. Its role in nature is to do with biodefense of the plants, which it lives in cohabitation with all the root systems of various plants. And it is a biodefense for those plants against other invading pathogens. But when it gets into a human opportunistically, then because of these virulence mechanisms, it causes potentially quite severe disease in people who are particularly diabetic, people who have hazardous alcohol use, people on immunosuppressive therapy. And all of those things are increasing in our Northern Australian population. We're having more diabetics. We've got more people now staying in Northern Australia for their cancer therapy rather than going down to Adelaide. So we're seeing an increase in melioidosis partly related to more people with risk factors. This is just a paper that got published a year ago of some of the, I'll just see if the pointer works here, yeah, of looking at a whole bunch of isolates. In fact, this is all the isolates that were available globally with whole genome sequencing, and this is looking at core genome single nucleotide polymorphisms, which means it's looking at genetic fingerprint of these. Of each of these is a bacterium. The red ones are the Australian ones, mostly from us in the Northern Territory, but also some from colleagues in the Kimberley and Queensland. And the first thing that this shows is that the Australian strains are ancestral to the rest of the world. And previously, work done by colleagues of ours in the United States had suggested that Burkholderia pseudomallei indeed did evolve out of Australia and moved across Wallace's line into Southeast Asia, probably during the last ice age, sometime between 16,000 and 20-odd thousand years ago. But this new work that we'd done with colleagues at the Institute of Pasteur in Madagascar, when they had increasing laboratory capabilities, they were starting to unmask that melioidosis is a big problem in Madagascar. And they sent us isolates, and we found that those isolates had evolved from isolates probably from Southeast Asia. So it went from Australia to Southeast Asia, and then probably sometime around about 1,500 to 2,000 years ago, the organism was transported with people probably to Madagascar. Half the population of Madagascar has evolved actually as people from Borneo originally, and the other half are people of African ancestry, and there's that admixture from around 1,000 years ago that makes up the population today of Madagascar. So the people from Borneo took this organism of melioidosis over to Madagascar, and more recently we've had collaborations with isolates from the Americas, and interestingly it then was moved with the human population in probably the 1800s or so, the 1700s, across from West Africa to the Americas, and that's with the slave trade. So this is all new information over the last couple of years. So the evolutionary spread of Burkholderia pseudomallei around the world, and it's all come from Australia, probably from right under the museum here. So from a human health point of view, what I'm interested in as a clinician and infectious disease physician is what determines why people get sick and why they can be so sick and indeed why they die, and of course how we can better diagnose it and then treat it. And as with most infectious diseases, these are the factors. The infecting dose, so you get a bigger load, then you're more likely to get more sick. The host risk factors, as I've already alluded to, are indeed for this opportunistic pathogen the most important thing. People die from ordinary staph infections, healthy people. So staph can infect healthy people and cause critical illness. That's unusual with melioidosis. Diabetics, though, have a particular deficiency in their innate immune system, which makes melioidosis dangerous for them individually. So risk factors are important. But increasingly we've been looking at route of infection, and this is relevant to our meeting here, and that is ingestion, which is a minority way that people can get melioidosis, because the majority is through skin, through cuts, motor vehicle accidents, and things like that, where it penetrates the skin and then spreads through the bloodstream. Increasingly, we are concerned, however, also about inhalation following severe weather events, and we've shown a link epidemiologically, and indeed now with air sampling, we've been able to isolate this organism from severe weather events where we're actually isolated from an air sampler and with wind and rain. And strain virulence factors is an issue as well. So this is how we are sort of looking at melioidosis. So I'm now going to mainly focus just on the relevance of water supplies and ingestion. So we've learnt from our colleagues in Southeast Asia, where they have a lot of unchlorinated water supplies, that ingestion is much more of an issue there than it is here in Australia, and therefore they're seeing more people presenting with parotid abscesses, and from ingestion they're getting gastrointestinal abscesses. This is a liver abscess here. They're much more common in Thailand and Southeast Asia than here, and indeed they have evidence from their water supplies of a high contamination of unchlorinated water supplies in rural parts in the paddy fields of Cambodia and Malaysia and Thailand. So the original molecular epidemiological studies on melioidosis was done here at the Menzies School of Health Research, and we're the first people to actually be able to, using some of the older techniques of genotyping, ribotyping, and then a thing called amplification polymorphisms, random amplification polymorphisms, and then pulse field gel electrophoresis. We first of all showed that the animal isolates can be identical to those associated human and indeed soil isolates on the same farm. Goats and soil isolates have been linked in goat farms here, where we've had clusters of cases, of fatal cases. And then with pulse field is what we use to link for the first time humans with water supplies. And this has been done twice now in Australia. One in the Kimberley, in the northwest Kimberley, there was a cluster of cases at a community there north of Broome, where the chlorination on the logbook showed 0,000, and there was a bunch of cases, including a number of deaths. And that was due to the aerator being heavily contaminated in that community water supply with Burkholderia from the environment. And my colleague Tim Inglis worked on that, but also involved some of my Menzies colleagues in some of this original pulse field typing. And then what we looked at was a remote community, which I'll now talk about briefly, in Arnhem Land, where we unfortunately had a series of deaths. And this is some years ago, and this has all been remediated by our environmental colleagues by basically establishing good chlorination of that community water supply, replacing the corroded pipes with, I think, PVC pipes and others. So we had 9 cases of melioidosis over a 28-month period with 4 deaths. This is 4 people dying from melioidosis directly attributed to their water supply in a remote community. If that happened in Sydney, do you think that everyone in Australia would know about it? Of course they would. How many people in Australia knew this happened? Well, a few of us in the Northern Territory got a bit anxious about it, but, you know, okay. And then 6 of the 8 human isolates were identical. So this was an epidemic on pulse field, and we've now just done whole genome sequencing on all of those and confirmed that that indeed is the case. And we did actually, the smoking gun was an isolate from the community water supply, and this is it. This is the bore, and this is the community water supply, and this is a photograph taken from our environmental health colleague, just where the inlet of the water supply, and it was indeed from here that we were able to culture Burkholderia pseudomallei and then type it and show it's identical to the cluster of cases in the humans. So it's also relevant. So our water supplies in the territory are chlorinated, and we're very confident that that's dealing with Burkholderia pseudomallei. Although Miriam will be talking about some of the other pathogens and melioidosis in the pre-chlorination sort of water supplies, and we've done a very large study, which I'm not going to talk about, with one of our particular water supplies in the territory, where we've isolated a heap of Burkholderia pseudomallei over a number of years, and we've been looking at it in different aspects of that treatment plant. After chlorination, no Burkholderia pseudomallei. Before chlorination, in various parts of the treatment plant, lots of B. pseudomallei with a number of different strains, and the evolution over time is a fascinating story, but a different story from what I'm talking about here. So basically, we also, however, we have many thousands of rural bores which people are using for their domestic water supplies. And Mark Mayo, who's been working on this for a number of years, showed that out of 55 bores, we were able to easily culture Burkholderia pseudomallei in a third of them. So a third of these rural bores in the Darwin rural region have Burkholderia pseudomallei in them, and this is all the molecular types, and they overlap with the human ones we get and the animal ones. So these are all potentially pathogens. And then this is a study done by one of our PhD students, Evan McRobb, who's now, he grew up in Townsville and then came over here to do his PhD, and he's now down doing his, I think, third year of his medical school training at the University of Melbourne. And he got into Melbourne University Medicine as a Northern Australian because of the quality of the supervision he got in Townsville, and then Miriam and others were supervising him here in the Northern Territory. And this is a success story for us in Northern Australia, where we can send off our best and brightest to train up in Southern Australia, and he will hopefully come back to the north. But this is one of his two papers, one of the two relevant papers to this story from his PhD. Here's Mark at the bore on this rural block, and this is a block not that far from out of town, where we had 2 cases of melioidosis in a year in an elderly woman and her son who lived on the block. And we found that they looked identical on our crude typing, so we thought we should take it further. And we indeed found that with our various other typing methods, they looked identical. So we went and did extensive investigation. This is before and after remediation. So we sampled the bore, the storage tank here, and then the garden tap, shower, laundry. This is sampling in the shower and the garden hose. And they were all positive before. And then the remediation that was put in by the owner was a $1,000 UV, electrical UV decontamination unit put in line here. And afterwards, still lots of Burkholderia mellioi in the bore and in the holding tank, but absolutely cleared the supply in the household. And just to show that it was real, that this was the smoking gun, in that circumstance, was we went on to do whole genome sequencing of all of the isolates from that. And we found that the water supply was not just, it was the source of infection. The clinical isolates from the husband and, the man and his mum, differed from the water supply by just one single nucleotide polymorphism. You don't get closer than that with genetic linkage. And we had similar strains from various blocks around the area, same on multi-locus sequence typing, but they were quite different on whole genome. So you need to go to this fine scale level to get your final epidemiological answers. So just to finish off, melioidosis is being unmasked around the world as labs are picking up on being able to culture it. And it's predicted that there are basically 165,000 cases globally, with 89,000 deaths a year, which is the same number of deaths as occurring from measles, way more than dengue, which gets a lot more funding, 10,000 deaths a year globally from dengue, potentially 89,000 from melioidosis. So it's a big issue for our northern neighbours, with a 40% mortality because of their difficulties with diagnosis and facilities. We have no idea the southern extent of Burkholderia mellioi. We had, as my colleagues from the Northern Territory here working in weather and water will know, that we had a really big wet year in 2011 in Central Australia. We had 6 cases of people who'd never left the centre. And Mark Mayo and I went on a road trip down there and sampled from this waterhole in a remote community where there'd been a couple of cases, including a death. And it was stacked, it was chock full of Burkholderia mellioi in this waterhole, in this desert-like environment. So we don't know the southern extent of Burkholderia mellioi. And what about all those remote water supplies in Central Australia? So this is just some warning this year. Risk of fatal mud disease spreads to Central Australia after heavy rainfall. And just to finish off on predicting the future, well, this is a paper from Miriam, which is very complex modelling. This is just showing our numbers of cases going up. But there's an additional association, as well as the associated with rainfall, with sea surface temperature and an ambient temperature, which means that with inevitable anthropogenic global climate change, we are going to see more presence of melioidosis in our environment, in our water supplies pre-chlorination, and we're going to also got more people with melioidosis because of the risk factors. So it's going to be more in our environment, and we're going to have more people at risk. So I'd just like to acknowledge, this has been going for a long time. Our studies here, we have fantastic collaborators at the hospital, NTCDC. Xavier's here from Environmental Health and his staff, and also Power and Water we've worked with, and particularly Wayne Sharp in recent years, and international collaborators. And then this is just the melioidosis team here, and that's Mark there who leads it, and Miriam leads our environmental work as well, and working also with CDU and Karen. Thank you very much.
From Melbourne Water. Thanks, Bart. That was really very interesting. A question about the ingestion route. So even though it's the smallest route, have you been able to sort of uncouple it all with the domestic exposure, whether it's some of it is inhalation from showers or percutaneous from cuts in domestic water? Like,
yeah.
What is the mechanism for ingestion to infection?
Yeah, so we think that it's, first of all, it survives gastric acid. And we've actually seen gastrointestinal disease in some of those earlier ingestion cases. And in Southeast Asia, they see gastrointestinal disease from ingestion. But we also think that the potential of aerosolization from a shower head in unchlorinated water supplies is a potential that we think may be implicated in at least one of our cases. But that's speculative. We're able to culture it from the shower head because of the contaminated water. And there's this issue of biofilm. Biofilm is a bit controversial with Burkholderia pseudomallei, and we're not sure how much that's relevant in the pipes and the mechanism. So you've brought up that really important point. So if you've got contaminated water, it can still get into cuts on your skin, insect bites, mosquito bites. You can ingest it, or it could be going up your nose, like Naegleria fowleri can. We know that's a route for melioidosis, and they actually can get a very similar brainstem encephalitis, which is rare in melioidosis, and we think that's people who have been, not so much from water supplies in Australia, but our cases in Australia of brainstem encephalitis have been people who have been swimming in water holes where they've been diving down and it's gone straight up the nasal passages into the brain, which is what Naegleria fowleri does. So all these mechanisms of spread into the body and through the body are things we can speculate on and get a bit of a feel from the clinical aspects of how they present.
Yes, Chris.
Oh, fascinating talk. Thanks, Bart. It seems like a lifetime ago now, it's almost 3 years ago, but I did my PhD on an isolate called the Burkholderia cepacia, and it was isolated from Florida soil, so through at high temperatures. But I was more interested in biodegradation of phthalates, because Burkholderia can break down a range of pollutants and things. But I do remember it being multiply antibiotic resistant. So my question for you is Burkholderia pseudomallei the same?
Yeah, look, thanks for that. I'm fascinated. It'd be great for you to speak with Miriam about your PhD. That was in the US. In the US, did you?
Well, it was a US isolate, but I actually worked on it in the UK.
Because we're very interested in the near neighbours, some of which can actually inhibit Burkholderia pseudomallei itself. So where we grow some of the Burkholderia near neighbours which are not pathogenic, but can be antibiotic resistant, including some ones related to Capacia, they will inhibit the growth of Burkholderia pseudomallei in that bit of sort of soil or in the microcosm. And Miriam's work on that. It is resistant to the commonly used antibiotics for pneumonia, and that is part of the reason why there's a high mortality. But it's not as resistant as Capacia, which is even more resistant, has a lot of other resistance mechanisms on top of the pseudomallei. So that interaction between all these environmental Burkholderia is fascinating. And you also brought up this bioremediation, and there are near neighbours of pseudomallei which people are seriously considering, as you implied, for bioremediation of damaged environments. Yeah, it's a great topic.
All right, can we thank Professor Currie again?